Hello, how are you? I hope you're having a wonderful day. Thank you so much for tuning in. I wanted to start off by asking a couple of questions, and then we're just going to dive on into who am I and why are you listening to this webinar. So my first question for you, are you struggling with any pain, fatigue, abdominal weight? What about leaky gut symptoms such as abdominal pain, bloating, constipation, diarrhea? Poor sleep? Are you struggling with sleep, either falling asleep or staying asleep? I know these are all random questions and you probably think none of them have to do with each other. Why is she asking me all this? But if you answered yes to any of these questions, whether it's the pain, the fatigue, the abdominal weight, the poor sleep, the leaky gut symptoms, you are in the right place. And maybe you're like, I don't really have any issues with those. Well, still stay tuned and listen because this may help you or this may help someone else that you know. I'm Jenni Berman. I'm a physician assistant and owner of Berman Health and Wellness. Berman Health and Wellness is a nutritional, functional medicine practice in Naples, Florida, where we strive to help individuals reach their goal weight, improve their gut health, and stay in the game of life. Our goal is to help you through natural remedies, nutrition, and optimal nutrient levels. So, looking deeper into your body, specifically your blood, and figuring out how we can help improve your symptoms. Today, we are going to be talking about 3 of the most common concerns that I see in our practice. Separately, we work with individuals who may have things like Hashimoto's disease, prediabetes, blood sugar instability, leaky gut syndrome, food sensitivities, and more. Though today we're going to be specifically talking about abdominal weight, poor sleep, and pain. Now, if you have reached this webinar, you most likely have gotten the information from Clinical Compounding, which is a compounding pharmacy here in Naples, Florida. We appreciate them sharing this information with you so that we can reach that one more to help feel a little bit better. We're going to talk about some of these concerns or symptoms that people have experienced in the past with us, and then we're going to dive into a medication called low-dose Naltrexone, which you may have heard before. Clinical Compounding does dispense LDN, and so we're going to talk about how that medication may be helpful for you. When we work with our clients, we initially perform a detailed medical consultation, diving into the individual's medical history, medications, supplements, activity level, careers, symptoms. We really want to be able to identify what's going on with an individual from the inside out, and it really, all this information really matters to us. We look at blood testing so we can really see from the inside out what is going on. It helps us to be able to figure out metabolically inside what's leading to the symptoms you're experiencing. Better yet, we need to figure out the problem that's causing the symptoms for each individual person. Abdominal weight can be from many things. You may have said, I've never had this flat tire around my stomach. I've never had weight issues until a certain point in my life, whether that was through a trauma or hormonal change, and now just can't get rid of it. No matter what you do, what you change with your diet, what you change with your exercise, you can't get rid of that abdominal fat. The abdominal weight can be from things like hormonal changes, so going through perimenopause, postmenopause, postpartum, having a baby, could be from medication changes. Insulin resistance is another common thing that we see, which is a metabolic dysfunction in which the body is not metabolizing our food efficiently, which leads to a blood sugar instability. So this can affect males, it can affect females, it can happen in our 20s and 30s, it can happen in our 70s and 80s. But the body actually holds on to food as sugar, which turns to fat most commonly in the abdominal area. Something else leading to abdominal fat, especially when we've never experienced it before, is having improper macronutrient balance, meaning your proteins, your carbohydrates, and your fats. You may say, yeah, but I'm eating the same thing I did before and now I just continue to gain weight. And that's because our macros do have to change as we age, depending on, again, our careers, the stress levels in our life, our activity level, our hormone changes. We have to be able to balance the nutrients appropriately. We see abdominal fat with improper activity level, which again changes for everybody. Abnormal thyroid function. So you may say, oh, my doctor told me my thyroid is normal. Well, that TSH, or the thyroid stimulating hormone, might be normal, but your other thyroid hormones may not be optimal. And so that's something else that we have to identify is, are all three of your thyroid functions as optimal as they should be, especially with your age, your lifestyle. Abnormal sleep cycle. So having an abnormal sleep cycle, not being able to sleep through the night, not being able to fall asleep if you're waking up for a couple hours through the night, this could also be contributing to abdominal fat. Something like sleep apnea could be contributing to abdominal fat. Even if you're wearing that CPAP machine, if we don't stabilize that sleep cycle pattern, that could also be contributing. Cortisol. Cortisol is a stress hormone that can be spiking several times per day and night. And not only does this cause some different symptoms like not being able to sleep through the night or being very fatigued during the day, having increased hunger, feeling more anxious or stressed, but also the high cortisol levels itself can actually cause a redistribution of fat into the abdominal area. We also see a lot of vitamin deficiencies, which can definitely be contributing to abdominal fat as well. And that is a simple thing to treat if we're able to identify it. The other thing we want to figure out, though, is why do we have vitamin deficiencies? And a lot of times it's going to be from not getting the right nutrients into our body, but even having abnormal gut health. And so if your gut is not as healthy as it should be and the intestinal structures aren't healthy, we're not going to absorb our nutrients or our vitamins. So I just ran through a lot of different causes of why we might have some abdominal fat, and getting really deep into those is going to help with correcting it and reversing that. All of these things that we talked about, the insulin resistance, the hormonal changes leading to differing macronutrients for our body or differing metabolic function for our body, the vitamin deficiencies, the cortisol level, the poor sleep, the thyroid function, all of these things are reversible. We can improve all of those things to be able to fix the problem to your abdominal weight. The other thing that I haven't talked about yet is leading to weight gain could be something like food sensitivities. So actually, I did touch a little bit on gut health just a second ago, but if we're consuming foods that we are sensitive to, causing an inflammatory response in our body, this can actually also lead to these cascade effects of things that I talked about with the vitamin deficiencies, the high cortisol levels, because of the stress on the system itself. You may say, oh, I don't have any food sensitivity issues. I don't get any hives. I don't get anaphylaxis. I don't have any stomach problems. But some of these other inflammatory symptoms that you're feeling, like pain, headaches, migraines, abnormal thyroid function, vitamin deficiencies, joint pain, poor sleep, all of these can actually be symptoms of a leaky gut or abnormal gut health. So in turn, this could lead back to the abdominal fat as well. So let's talk a little bit more about poor sleep. We hear that a lot, and I'm sure there's many of us listening right now that say, yep, I have terrible sleep. I always have. I can't sleep through the night. Or you're saying, I always had perfect sleep, and now all of a sudden I am waking up every morning at 3 o'clock in the morning and I can't fall back to sleep. It's very frustrating. By the time I do fall back asleep, in 30 minutes, my alarm goes off. This is very, very frustrating. Not only does it cause you to be fatigued, frustrated, but it also is leading to a cascade effect of increased pain, increased abdominal fat, the vitamin deficiencies. So let's jump into that a little bit more. The poor sleep can actually be a result of the blood sugar instability or insulin resistance that I touched on just a few minutes ago. When we have an abnormal blood sugar throughout the day, meaning your blood sugar is rising and falling more than normal throughout the day, this pattern actually continues at night. So when we go to bed at night, our blood sugar is high, and then the blood sugar dips down. So usually happening around 2 or 4 a.m., that blood sugar dips down pretty low, and the body actually wakes us up to try to regulate that blood sugar and to bring it back up to a normal period. So we're awake for a couple hours while the body's working really hard. You don't realize it, but it's working hard to release insulin and bring that blood sugar back up to a stable point. Then we're finally able to go back to sleep. Now, a couple hours later, we wake up in the morning, start our day, and we're actually not hungry. And the reason for that is because the body has done all that work to bring your blood sugar back up, you're actually now in a fed state. And so the body thinks you've already eaten because the blood sugar is high, so you're not hungry. Come 10, 11, noon, you're like, okay, now I'm hungry, I gotta eat something. But we've already started this pattern of the blood sugar being irregular since we didn't eat earlier in the day. So now we're back in that vicious cycle of the blood sugar starting to fall. We finally eat something like around 11 or 12 and the blood sugar comes up. And then we don't eat for a long time and it starts to fall and then it spikes up. And now we're back into that abnormal pattern of the blood sugar spiking and falling. So like I said, when we, are sleeping through the night, the body doesn't want that blood sugar to be low, so it's gonna wake us up. Whereas if we can get the blood sugar more stable with consistency throughout the day, meaning getting protein throughout the day, stabilizing that blood sugar in the day and then night, this can actually help with improving that sleep pattern. We're also going to talk about another thing that can affect our sleep, and that may be due to vitamin deficiencies. So magnesium is actually a really important vitamin, not only for the metabolism, helps with avoiding muscle cramps, avoiding constipation, but it also relaxes our body. So if we have a magnesium deficiency, it could be leading to some of these other symptoms like the constipation, the leg cramps, headaches, or migraines, but it also could be affecting our sleep pattern. There's something else called L-theanine, which is a natural amino acid that our body doesn't make, so we have to obtain. And sometimes our bodies don't obtain enough or absorb enough. And actually being deficient in L-theanine can lead us to being more anxious, maybe even depressed, but also can affect our sleep pattern as well. L-theanine is really important to stabilize the stress receptor in the brain so that our brain can actually quiet down, go to sleep, and get restful sleep at night. We talked a lot about cortisol levels a little bit ago, and I did mention that when cortisol levels are spiking day and night, let's back up a little bit and talk about a normal pattern for cortisol. Cortisol levels are supposed to spike around 4 to 6 a.m. That's a normal wake up time, or at least back in the old days when the sun came up. 6 a.m. is where that cortisol level should be at its highest peak and then coming down throughout the day. When we are going through chronic stress, or when we've been in chronic stress or have had a trauma and our HPA axis, which is the stress axis in the brain, has been altered, our cortisol levels can actually spike throughout the day and throughout the night. And this will also affect our sleep pattern. The body is not going to keep you asleep while your cortisol level is spiking around 11 or 12 or 1 a.m. So going through those, chronic stress periods or the traumas or even things that happened 30 years ago could be affecting that stress axis to where the cortisol levels are abnormal. The other side of that is high cortisol levels and insulin resistance, or the blood sugar instability, actually play hand in hand. So every time the body increases cortisol, it increases insulin. Every time the insulin comes up, the cortisol level comes up as well. So if you do have a diet that's higher in sugar or carbohydrates or inflammatory foods for your body, this could also be stimulating a cortisol response, affecting our sleep. Medications can affect cortisol levels too, so that's important to know. And we, all in all, with all of this being said, when it comes to sleep, we need to make sure that we're getting the right nutrients for our body, the right protein, carbohydrates, and fats during the day for blood sugar stability, the right types of foods to be reducing as much inflammation as possible into our system, and then making sure that our vitamin levels are stable. All right, so this has been a lot of information so far. We've talked about abdominal fat, we've talked about poor sleep and how the sleep can be actually contributing to the abdominal fat, but the abdominal fat can also be contributing to the sleep. It's, such a vicious cycle. I'm going to dive on into pain. Pain is a little bit different than what we've been talking about so far, but oy vey, this can be a tough one. The initial target to help with improving pain levels is assessing the source of inflammation, which we find is most commonly related to our foods. Of course, traumas can happen. You get in an accident or you fall off a ladder, you're going to have pain there. But when it's a chronic pain source, or a chronic pain that you've been experiencing, meaning long-term, maybe dull, achy, could be getting worse, but you've been experiencing it a long time, whether it's joint pain, back pain, migraines, we have to identify the source, which is very commonly related to the foods you're eating, which are causing an inflammatory response on the body. Many times clients will tell me, I don't have any stomach issues, I don't have any food allergies or sensitivities, like I don't get anaphylaxis or hives or anything like that, but yet they have a primary complaint of the joint pain, the back pain, the sinus congestion, headaches, list goes on and on and on. And I'm like, okay, as I'm writing my notes, kind of putting all these things together, and then at the end I'm like, your body is inflamed and we got to figure this out from the inside. All of these things are signs of internal inflammation and food sensitivities. Many times we're able to identify the cause of pain or even skin issues from looking at what we call IgG or immunoglobulin G, which are food sensitivity levels. There's actually a blood test that can look at these levels and see out of 184 different foods, what foods is your body sensitive to, what foods is causing an inflammatory response for your body on a scale of 0 to 3, 0 being no sensitivity, 3 being a high sensitivity. We can also look at allergies, which is immunoglobulin E, a little bit different. So we can look at the two and see how they differ. Now, our body can have actually worse reactions to food sensitivities than it can to allergies. So, it's a thing that we really have to look at both and identify this from the inside out. Just because you don't have anaphylaxis doesn't mean you don't have an allergy or a sensitivity. When our body is sensitive to a food, the gut lining is broken down. So we have little structures in the intestines that are supposed to help with motility, moving food through, but also absorbing our nutrients through these little structures. When we have food sensitivities or when we have a trauma or chronic stress or anything leading to more of an inflammatory state, these structures are broken down. And what actually happens is food then can pass through into the tissues, into the bloodstream. Toxins can penetrate into the tissues. So now the immune system is heightened. And actually treating these things as a foreign body. So we have foreign bodies in our bloodstream, foreign body in the tissue, and the immune system goes on overdrive. What happens is that once the immune system is triggered, these antibodies, which are the immune markers the immune system creates, can go and attack different things like our organs. So go and attack the thyroid and cause an autoimmune thyroid disease, attack our joints and cause arthritis, our head and cause the headaches. But even something called cytokines, which are inflammatory markers that can reach the brain, develop as well. And that's where the food sensitivities or those inflammatory markers can impact us, causing mental health disorders, the migraines, or even things long-term like dementia. Overall, inflammation is systemic, and that a lot of time is where we're getting the pain that we're experiencing. There are particular amino acids that can help with gut recovery. So once we're able to identify the foods that's causing the problem, there's certain amino acids that can help with repairing that gut lining and reducing the inflammatory process in the system, calming down the immune system so we don't get into that autoimmune state, or so we can reverse that autoimmune state that we've already been in. Overall, we have to protect our gut health. So to kind of recap everything that we've talked about so far, targeting proper macronutrients, meaning your proteins, your carbohydrates, and your fats, is very, very important. We have to fuel the body appropriately and with the right types of foods. Proper vitamin levels are essential. So targeting the proper vitamins and nutrients through your food, but also replacing those through vitamins if needed based on your levels. Improving your gut health through identifying inflammatory foods and amino acid replacement is vital. Now, there's one other thing that I said we were going to talk about, and we're going to jump into that now. And this is called LDN, or low dose naltrexone, which is actually really, really helpful in reducing inflammation, helping with pain, and actually helping with sleep and weight loss. Low dose naltrexone is an opioid receptor antagonist, meaning it actually inhibits the action of the opioid receptor or the pain receptors. Naltrexone at the normal dosage of 200 milligrams is often used in the treatment of addiction of things like alcohol and opioids. We are talking, however, about a low dose of this medication, such as 1 milligram, 2 milligram, 3 milligrams, 4 milligrams. So I said the normal dosage is 200. We're talking as low as 1 milligram up to 4 milligrams to be used in the sense of low dose naltrexone. The chemical makeup is similar to the endorphins that our body actually makes. Endorphins are natural painkillers in our body. So the low dose naltrexone makeup is actually kind of mimicking the endorphins in our body. Low dose naltrexone even helps with regulating T regulatory cells, which is a type of pain receptor. It's going to help with regulating those pain receptors, increase the endorphin effects of our body. The T regulatory cells are vital in regulating the immune response, turning the immune system on and off so it does not get stuck in overdrive. I had talked earlier about how when our immune system is at a constant state of elevation or constantly being triggered by our abnormal gut health, the toxins, the food sensitivities, it sends us into what we call autoimmune state, where the immune system is just constantly being driven. So the T regulatory cells that the LDN can actually help regulate will help control that immune system so that we are not stuck in overdrive all of the time. So it actually can help with reducing autoimmune disease and chronic inflammation in the system. T regulatory cells stimulate the microglia, which are the central nervous system immune cells. These immune cells stimulate inflammatory factors leading to our fatigue, pain, sleep disorders, and autoimmune diseases. So just kind of going a little bit more in detail how these cells are really contributing to the autoimmune dysfunction that can occur. And so with the LDN, it can help regulate this. The LDN actually blocks the opioid receptors, and that's what helps to regulate those T cells. The LDN, the medication that we're talking about, binds to opioid receptors for about 1.5 hours, and the pain blocking and anti-inflammatory effects occur for about 4 to 6 hours after we take the medication. So even though it blocks the pain receptors for 1.5 hours, the effects of that blocked pain receptor for that period of time gives us the effects for about 4 to 6 hours of the body being able to calm down, reduce inflammation, and get those regulatory cells more regulated. LDN also helps with increasing our own endorphins, which I've already mentioned, and those are natural painkillers. So now, not only do we have the opioid receptors being blocked, the effects of that for 4 to 6 hours of reducing overall inflammation, but we're also releasing more endorphins, which of course is going to last a little bit longer in our system. LDN is very effective in reducing pain overall in individuals for things like arthritis, migraines, headaches, and overall autoimmune inflammation. One form of LDN actually can block specific receptors called toll-like receptors, which are released from T cells themselves. The toll-like receptors are part of the immune system and are activated with inflammatory responses, which can lead to the autoimmune dysfunctions that we've been talking about. So to be able to decrease the cytokines, which we talked about are those inflammatory cells that can actually reach the brain, the LDN can also help with reducing things like depression, anxiety, bipolar disease, and other mental health disorders. Now, of course, LDN is not the sole medication for treating these type disorders, but it can be helpful at reducing those cytokines. Again, we got to make sure we're targeting the whole body. So figuring out what's causing those cytokines to develop in the first place, which a lot of time is, like we said, related to food sensitivities, which can lead to mental health disorders. Occasionally, individuals need further medication to help with stabilizing that while we're getting the inflammatory process under control. But LDN can come in there and be very helpful as well. Cytokines can actually damage epithelial lining and causing more gut permeability, so that breaking down of the gut lining. So, being able to target all of these things at the same time can be really, really helpful. Anything that we can do to prevent those toxins from penetrating our tissues and increasing those circulating antibodies and inflammatory markers. LDN, to kind of recap, can also be very helpful in reducing those toll-like receptors, which will reduce the antibody development and help improve that leaky gut syndrome, the gut permeability. We want to do, something we haven't talked about yet, which some of you may be experiencing, are things like Crohn's disease, ulcerative colitis, irritable bowel syndrome. These are all autoimmune conditions that can be improved by figuring out that gut health, figuring out your food sensitivities, and in the interim, potentially using the LDN to help with reducing the inflammatory response and antibody level. One interesting thing about LDN that I haven't mentioned yet, and so I'll just kind of throw it out there right now. There's not a ton of information on it yet, but we'll throw it out there, is actually LDN can help with reducing cell proliferation. So there's some studies being done to see if LDN can actually help with reducing cancer cells. Again, we need more research on this, but I thought it was pretty interesting just to mention that. So I've talked a lot about how LDN can help with pain, can help with inflammation, autoimmune disease, improving overall gut health and the lining of the gut, potentially being helpful in reducing cancer cells. We're going to talk about two other ways pretty quickly on how LDN may be helpful for you. Your weight. I mentioned that it could be used in helping with weight loss. But there are actually studies showing that LDN can help with suppressing appetite, reducing portion sizes and cravings, which then helps with that weight loss process. In addition, if we have decreased inflammation, the metabolism will be more focused on what it's trying to do if the inflammatory process is low. If we're at a heightened state of inflammation, the last thing the metabolism was worried about is burning fat and losing weight. It is putting all of its energy towards just getting you through your daily functions and dealing with the inflammation internally. So, that's another side effect. If LDN is reducing your inflammation, your metabolism actually has the fuel and the energy it needs to be able to focus on what it needs to and help with weight loss. But besides that, it can be helpful in reducing the appetite overall and the portion sizes. It's actually also been shown to help with individuals to reduce alcohol because it can help with reducing the cravings for alcohol. Reducing alcohol itself can help with weight loss, just as it's less sugar, less calories, less empty calories, so that's nice. But we're going to talk a little bit more about the portion control part. LDN is not stimulating like other appetite suppressants, so it doesn't cause that increase of heart rate or blood pressure or anything like that, which is nice. It can actually be used in several different cardiac conditions, whereas other appetite suppressants may not be able to. But just being able to reduce portion sizes at each of our meals not only can help with metabolic disease and insulin resistance and cardiac disease, but overall weight loss as well. All right, so one more thing we're going to talk about, which I talked about earlier, how important sleep is, not only to make us feel good, but also important for the metabolism. And LDN can actually help with that too. Now, ironically, one of the side effects to LDN for some people can be vivid dreams at night, but there's also studies showing that it can actually help people with sleep. Because LDN helps with reducing the chronic stress and inflammatory levels within the body is actually able to be a little calmer and reduce the stress response, bringing cortisol levels down and allowing the body to sleep. Also, if the cortisol levels are more stable, we're not releasing as much insulin, which helps with blood sugar stability as well. So now we're actually able to sleep through the night. More than that though, the LDN can actually help the body with balancing the neurotransmitters in the brain, like serotonin, dopamine, and GABA. Balancing these neurotransmitters improves our mood and our brain function, but also helps with more of a proper balance for relaxation and sleep. By regulating those stress receptors in the brain, it can quiet down and have peaceful sleep at night. LDN actually can lead to a rebound surge of cortisol levels in the morning, which will help with more alertness during the day and reducing a cortisol surge at night. So we normally will recommend our patients to take LDN in the evening time. One, because that's when the opioid receptors are most active, is through the nighttime period. But also, if it's helping with reducing the cortisol level at night, reducing a surge of cortisol level at night, we'll actually be able to sleep a little bit deeper, and then improves that cortisol surge earlier in the morning, leading to alertness when we wake up. Cortisol level spikes, and then it starts to come down throughout the day as it's supposed to and doesn't surge as much at night. So that's why we typically will recommend individuals to take LDN in the evening, but also a way of how the LDN can be helpful with our sleep pattern as well. All right, now I had just mentioned that LDN we usually recommend to take at night, and so I'm going to go a little bit deeper into that. We ideally recommend taking it between 9 p.m. and 3 a.m. Now, I'm an early bird when it comes to rising and sleeping, so I'll usually tell people, my clients, try to take it 30 to 60 minutes before you go to bed at night. So if that's in a 8 to 10 p.m. range, great. I really encourage you to have a normal sleep pattern. So trying to go to bed by 9 or 10, waking up earlier in the morning. But if that's not you and you're a night owl, then you can certainly take it up until 3 a.m. But probably around that 9 to 10 time is more effective. We have occasionally had clients say, oh, it just gives me vivid dreams, I can't take it at night. And you can take it in the morning time. It still is effective on the opioid receptors. It's still going to help with those cortisol levels, with regulating that. So it is okay to take in the morning time, though we always try initially at nighttime. Okay. Now, the other thing that I recommend with LDN is that we actually titrate up the dosage of LDN. So I said the target dose is somewhere between 1 and 4 milligrams, and that really depends on the individual and depends why we're using it, how much inflammation they have, their sleep concerns, their pain concerns. But what we'll do is we often will start with 0.25 milligrams, which is very, very low dose, and titrate it up over a week, each week. So 7 days at the 0.25 and then slowly working up to the target dose that we're going for that individual. And like I said, that differs for everybody depending on the reason. The titration can help with avoiding those vivid dreams at night, or any side effects that the individual may have from taking the LDN, but also it helps us to really identify what's the right dosage for the person. We don't want you to take more than you have to, so I believe titrating is the best way to go. You should always speak with your physician, your providing physician, before starting or changing any medications. We highly recommend using LDN in conjunction with identifying food sensitivities, promoting proper gut health, hormone balance, vitamin regulation, and proper macronutrients for your body, meaning those protein, carbs, and fats. we have to fuel the body appropriately. There's no one magic thing to do. We have to fuel the body. We have to put all of this together. So making sure you're using the right medications and supplements with the right meal plan for your body specifically. Treatment plans should always be specific to you and not just a one size fits all. I hope everybody has found this really informative. Thank you for being patient as we go through all of that. I know it was a lot of information. I am really happy to answer any questions that you guys might have. We will include more information as far as how you can get a hold of us. Again, the practice name is Berman Health and Wellness. If you do have any specific questions about you or a friend or anyone specifically, I'm happy to answer, but we more just wanted to provide information to you on how you can help yourself and give you some good nutritional advice and talk a little bit more about certain medications that you may have heard about from your doctor or from clinical compounding itself. So if you would like to reach out to us, our website is www.bermanpt.com/wellness, WELLNESS. My name is Jenny. My email is Jenni, JENNI, at Berman, BERMAN, wellness.com. Again, we will have all this information for you, and we are always happy to answer any questions that you may have. We look forward to seeing you guys again and doing another nutritional seminar for you so we can continue to provide to you as much as possible. All right. I hope everybody has a great day.